According to the World Health Organization, over 450 million people are diagnosed with mental illness right now. And with that staggering statistic, mental illness has been shooting to the top as one of the top reasons for people having and receiving disability checks around the world. If you've watched any of my other previous speeches, you know that I'm one of those 450 million people suffering from mental illness. And in this speech, I'm going to talk about my personal experience with traditional medicine and why I think homeopathic medications are more effective, or homeopathic treatments are more effective than traditional medicine. Just a little bit of background and to build my credibility. In 2014, I was a student at the University of Notre Dame, and I was studying pre-med there, and I was hospitalized for an attempted suicide. When I got to the hospital, I was extremely confused and disoriented. I didn't really know what was going on, and I trusted that my doctors would make the right decision for me. I didn't ask many questions. I just kind of let them make my game plan. And when I was discharged, I was on 3 new medications, and they had increased my doses on my other 2 medications. For any of those of you that know about benzodiazepines, I was taking 1 milligram of benzodiazepines 3 times a day. I was a zombie. I couldn't function, I couldn't go to class, and subsequently I had to drop out of Notre Dame, which was my dream school and my life. So I came back home, and my experience with traditional medication is a lot longer than that, and I'll kind of share throughout this a little bit more of my story, but that's just the background information. So in this speech, I'm going to talk about 3 main points. The first point being, why do people stop taking these medications? More specifically, what are the adverse events of medications that are prescribed for mental illness? The second point is the stigma associated around taking mental health medications and mental health in general. And the third point is, what is the proven and researched effectiveness of these homeopathic and alternative medications and therapies? So basically, I'm trying to argue that homeopathic treatment and alternative therapies are a lot more effective for symptom mitigation and overall decrease in disorder symptoms and improving quality of life. So why do people get off of these medications? Like I said, that's the first point that we're going to go over. So there was a recent study. It was a meta-analysis of 34 randomized trials in 2011, and this study talked about weight gain. Specifically, it talked about antidepressants and antipsychotics. In the study, it was proven that people had a minimum of 10 pounds of weight gain and up to 40 to 50 pounds of weight gain within the first 2 months of taking the medications. That's insane. For a 20-year-old girl to go on a medication that causes them to gain 40 pounds, do you think that's going to help their mental health, or is it going to hurt it? Personally, I was put on an antipsychotic after I got home from Notre Dame and was in a day program. They put me on an antipsychotic and I gained 60 pounds in 2 weeks. I stopped the medication right away, but the damage was already done, and that weight has never come off, and I'm still working on getting it off, but it never came off. So that's a really big struggle, and a really big adverse effect for a lot of these medications is that weight gain, and a lot of reasons why people get off these medications is for weight gain. Another study also it was done in 2014, and it studied the adverse effects or the side effects of a medication called Celexa, which is a pretty well-known antidepressant, and it is in the most major class of selective serotonin reuptake inhibitors, which is the biggest class of antidepressants prescribed in the U.S. The symptoms that were seen to be statistically significant in this population of 350 participants, they gauged at the beginning what were their symptoms, middle, and 6 months, and then a year. The symptoms and the adverse effects that they had after starting these medications than prior to, I'll list them off for you: agitation, dry mouth, sweating, inability to become aroused, constipation, diarrhea, dizziness, daytime drowsiness, difficulty sleeping, rapid heartbeat, and hot flashes. Personally, I was on Celexa, and I definitely had difficulty staying awake during the day, which is really, really hard when you're in clinicals for 8 hours during the day and you're trying to take care of patients and trying to study and do all these different things, it was really difficult. And honestly, it made me pretty depressed. And I had so much anxiety at night thinking about having to wake up in the morning and dreading the feeling of tiredness. So those are some of the reasons why people get off of these medications and why, quite frankly, I got off of these medications. But it's not as simple as that, as these adverse effects. There's also a bigger picture about culture and about how people look at you when you're on these medications or when they find out that you're taking psychotropic medications. So this next section, we're going to talk about the stigma surrounding mental illness and mental illness medications. So there was a study by Foster that was published in the Journal of Ethical Human Sciences that showed a comparison of the different types of advertisements for drugs. And that might not seem that significant, but if you think about it, that is a depiction of our culture and what our culture thinks about these medications. So the advertisements for psychiatric medications, they had less text in them, they had less explanation about what the actual drug was and what the actual drug did, and it had a lot more negative pictures than positive pictures compared to non-psychiatric medications. And at the end of the study, they found a direct correlation between the stigmatization that was depicted in these advertisements and non-adherence with medications. Basically, people see, hey, people don't want to really be friends with you if you're on these medications. People don't really want to be friends with you if they know that you struggle with mental illness. And that makes you want to not take your meds because you want to be normal, quote unquote, just like everybody else. And you don't realize that mental illness is a valid illness, just like Parkinson's or a traumatic brain injury or any other illness or disorder or disease. Just to give a little bit of real life experience to this story, my fiance is a veteran and I'm actually on a couples retreat right now for veterans. And I was talking to some of the veterans about mental illness and about how I had to give this speech, and they were telling me about their stories and their experiences and their friends' experiences. And 5 out of the 6 veterans all admitted to taking psychotropic medications at some point and then discontinuing the medications quickly when realizing that, hey, it's not tough to be on medications. It's not what a soldier does. It shows weakness and these different things, as well as all the adverse effects that they were having. So the adverse effects paired with the stigma of being a tough soldier led them to stop taking their medications. And it's not unknown that suicide amongst veterans is extremely high, and it's a really, really sad reality that a lot of us have to deal with. So if we can't use these traditional medications, or if these traditional medications have been proven to be ineffective, then what do we do? My proposal is that we use alternative or homeopathic treatments. Specifically, I think diet, exercise, and mindfulness are extremely effective. Now, I don't just think that these things are effective. I've lived them, so I know they're effective, but there's also research to back up these thoughts or this belief. So there was a recent meta-analysis done in 2011, and it looked at 15 different studies. So a meta-analysis looks at all of the different studies and kind of consolidates the information. And what they found in these studies is that exercise has been proven to be successful and an effective form of therapy for depression and many other major disorders. But this meta-analysis didn't stand alone. There was actually 7 other meta-analyses that also proved that this exercise is a great way to improve your mental health. There was a study in 1990, 1998, 2001, 2006. There was 2 studies in 2011 and 1 study in 2009. And there are many more studies out there that has proven that this is an effective way to improve your mental health. Also, it specifically shows that yoga and mindfulness are a great way to exercise your body and to improve your mental health. The last study I'm going to talk about was published in the Indian Journal of Psychiatry, and it talks about diet. So basically, it's shown that in many Asian and American countries, we have a deficiency in nutrients, especially in specific vitamins, minerals, omega-3s, and specific like vitamin B12 and different things like that. And this study saw a 90% decrease in symptoms with supplemental adjustment to people's diets and changing their diets. So obviously, these are two great ways to improve mental health, and it has done an amazing thing for me. Although I don't look like I've lost weight, I feel so much better. I've done the Whole30 diet. I've started going back to the gym, and I feel like a better person. That doesn't mean that I don't struggle, but I feel like I'm managed and that I'm under control, and I'm not on any medications. So all of these studies and my personal experience combined have shown that homeopathic medication is a great alternative and a very effective alternative to traditional medicine. My hope is that people start to take this type of therapy and this type of treatment more seriously, and that when you go to see a doctor for mental health, they don't just throw medications at you and hope that everything gets better. My hope is that more people start coming out like the doctor I see now who prescribes me diets and exercise instead of pills. So we've looked at why people don't take their medications, we've looked at the stigma surrounding the medications, and we've looked at how effective these medications are. Moving forward, I think this is a great option for many people out there who have mental illness and are struggling with mental illness every day. So as I end all of my speeches, if anyone out there is struggling from mental illness, you're not alone and you're loved. Thank you.